Hi, I just want to tell you one particular information. This is regarding the medical science. The advancement in the medical science, in the technology, what they use today is really robust. And when you compare this technology, it was there 20 years ago. I could say that, because 20 years ago itself, they were able to record the operation. They were able to record each and everything. Whenever you get into any hospital, the procedure is whatever it may be, whether it is government hospital or private hospital, everything will be noted. First the registration, then the treatment, the diagnosis at first. Then if you are getting admitted for some reason, on every day basis, whatever medicines are provided, prescribed by the doctor, will be checked by the doctor who is coming for the rounds. Everything will be checked thoroughly. Whatever medicines prescribed by the one who diagnosed the problem was noted and also kept. You could have seen the pad with the case sheets that will be there with, that's just close to the patient's bed, that will be there. The one who is coming for the rounds, he will be checking. He was always checking whatever medicines given and the condition of the patient, the improvement, and what else, if at all, if there is any other test should be taken, that will be noted by the doctor who is coming to attend the patient. Inpatient, I'm not talking about the outpatient. Inpatient, I just wanted to talk about my mother's angioplasty. At first, we were checking with many, because they have the option in Apollo hospitals. They do have the option. I will talk about it later. I just wanted to tell you the procedure. At first, they diagnosed it with the test like treadmill test, and there were so many tests before they are planning for angiogram. There are many tests. When you are walking on the treadmill, that will be noted, and the ECG, and also so many tests are there. They just don't prescribe the angiogram, and the angiogram will be taken, everything will be recorded. You don't, if at all, if you have no idea about the procedures, please try to get it. Everything will be recorded. I'm talking about the time. In 2004, they recorded the whole operation. Angiogram was recorded, the operation was recorded. They gave the CDs. How they did that? Don't you know about all these things? Everything will be recorded, can be recorded. There is no such thing in this world. We cannot tell you no one can understand, no doctor can understand. It's not the case. Case sheet is going to talk about each and every diagnosis and the treatment, the medicines, whatever given, everything will be noted in the case sheets. Any doctor can understand what happened. Whenever you get admitted in any hospital, they will check the medical history, whether are you having any allergy. They ask this particular question at first. Allergic to any medicine. Even before the blood donation, so many questions are there. Hepatitis B related to jaundice. Got it? Operation. Is there any operation performed recently? Do you have any allergy? So many questions are there, at least 20 questions are there. Before blood donation, you cannot simply donate your blood. They have all the questions related to jaundice. Have you suffered from jaundice? Hepatitis B? Any life-threatening disease or infection? And they will ask a question related to the operations. Any surgery performed? The period also should be mentioned. 3 to 6 months. Do you think that the people are so mad? Eh? It's all about saving the life. They have lot of parameters. And whenever the operation is performed, if they are able to record the operation, you just imagine the angioplasty was recorded and they gave the CDs in Apollo Hospitals, Nungambakam, Chennai. The strict diet was prescribed by the doctor in the cardiology department as well as by Dr. Balaji. He was a specialist in this field, taking care of diabetes mellitus related patients. I can identify his voice. By closing my eyes, I can simply identify the doctor by his voice. My mother was there. After post care was there, no? We are in 21st century. No one can state that only the doctor who performed the operation is having the idea about everything. That's totally false. Everything is getting recorded. You can record the operation, whatever performed, and also everything will be noted while the patient is leaving. The summary will be given, where, how the operation was performed. The diagnosis is there. Then the plan will be there. Then they will record the operation. Then the summary will be there. Then the prescription will be there. Then the dietitian will be there. If you get into any hospital for anything, you must check with all these things. They will check at first. The questions will be there. Do you have any issue with any medicine? Is there any allergy? Any infection? First they diagnose the thing by asking questions. The oral diagnosis will be there. Then the test will be there. Then they plan for the treatment, and they will check with the patient and also with the family, and they will explain the procedures, and then plan for the before the surgery